My name is Dr. Fadi Habib. I'm a urologist and I've been practicing for 20 years in Chicago. I went to medical school in Beirut, Lebanon, where I was born, the French School of Medicine. I have a French state doctorate in medicine from them. And I went to residency in Beirut, then I repeated it at the University of Toronto in Canada to become board eligible and certified. I usually practice general urology, so I treat all kinds of patients. People think that urology is a man's specialty, but it's not. At least 40% of my patient population are females. My areas of interest are general urology, so I do everything in terms of cancer surgery, benign prostatic enlargement, stone disease, erectile dysfunction, but also I do a lot of female incontinence and pelvic floor reconstruction. There is a lot of patients around in our community who have benign prostatic hyperplasia, or what's known as BPH, or benign enlargement of the prostate. And I developed interest and expertise in laser surgery of the prostate, which is a form of minimally invasive surgery to treat that condition rather than the old way, which is what used to be called TUR prostate, which was more invasive and requires patients to be hospitalized for at least 2 days with more complications of bleeding and sometimes serious complications. So I developed an expertise in that technology, and I even developed my own techniques. And I was one of the first few urologists to start this in Chicago, even perform it in the office, which is very few offices in this country overall do laser surgery in the office. Actually, it's one of my practice philosophy to always provide state-of-the-art treatment and to my patients. And I always remain current by training myself for new techniques, like robotic surgery that came out after I finished my residency and fellowships. I went back and took courses, and I was proctored for a few cases, and then I'm performing that on my own. The same for laser surgery that also came out after I started. I go to conferences. I always keep updated with my knowledge and my techniques. Presence Health is an institution that I think their mission is to serve the community in a compassionate way, regardless of the patient background or financial situation. And that's why they keep coming here. We had a meeting this morning, and we know that the emergency room here attracts a lot of patients from the community. And we always wonder why they bypass so many other immediate care centers or urgent care centers that come here. And I think because of the mission of Presence Health. My main philosophy from the moment I started practicing is to treat a patient the way I would like to be treated if I was one. So the patient is treated with great respect and dignity. I always ask myself the same question every day. Why patients come here to see me personally? And I think because they know that I can provide good treatment, I respect them, and I give them good outcomes. And that's what I'm striving to do from the moment I started till now. When you start practicing, at the beginning, nobody knows about you. Throughout the years, you see patients, and they recognize me everywhere I go. I mean, in a city like Chicago, sometimes I'll be downtown or walking, crossing the street, and the bus driver will stop and say, "Hi, doctor, you're my doctor." And slowly, I start building up a loyal customer base. And they start referring me their family members, their friends, and a good percentage of my patient referral comes that way. When a patient comes back and is very happy and appreciative, but mainly happy with their outcomes, that's the most rewarding moment for me, personally.